So hello everybody, today we are going to learn about the tympanic membrane, which is a membrane separating from external and internal ear. So here is the external ear, formed by the external acoustic meatus and pinna of the ear, and the ossicles are seen in the middle ear. And the semicircular canals with the vestibule forms the internal ear. So the membrane, what you can appreciate here, which separates external ear from the middle ear, is tympanic membrane. So tympanic membrane or the eardrum is a semi-transparent membrane which separates the external from middle ear, and it is the only membrane in our body where three germ layers join to form a trilaminar structure. We know the three germ layers are ectoderm, endoderm and intervening mesoderm. So all three layers join together to form a trilaminar oval structure with 1 mm of thickness. So that is about the tympanic membrane. And the diameter of it is around 8 to 10 mm. So the thickness is around 1 mm and the diameter is around 8 to 10 mm. It is positioned obliquely at an acute angle of around 55 degrees. So it makes an angle of 55 degrees. And the membrane forms a fibrocartilaginous ring that is attached to the tympanic plate. Subdivisions of tympanic membrane. So here is the tympanic membrane viewed from the lateral aspect of tympanic membrane from the external ear. It is divided into two parts, pars tensa and pars flaccida. Pars tensa, it forms the most of the tympanic membrane. And it is thickened at its periphery to form a fibrocartilaginous rim called as annulus tympanicus. The fibrocartilaginous rim presents a notch above. From the margins of the notch, the anterior and posterior malleolar folds extends to gain their attachment to the lateral process of malleus. So here is the anterior malleolar fold. So we can see the margins of this notch, the anterior and posterior malleolar folds extend to gain their attachment to the lateral process of mandible. So from the margins of the notch, the anterior and posterior malleolar fold. So the notch is here, where the annulus tympanicus is present. So along the margins of the notch, we can see anterior and posterior malleolar folds. This is anterior and here is the posterior, attached to the lateral process of the malleus. The handle of the malleus is firmly attached to the inner surface of pars tensa. So we can see the handle as well. So the handle of the malleus is firmly attached to the pars tensa. So next about the pars flaccida. Pars flaccida is also known as Sharpnell's membrane. And it is a small triangular region where the lateral process of the malleus between the anterior and posterior malleolar folds are present. So here is the anterior malleolar, posterior malleolar and lateral process of the malleus. Altogether this area is called as pars flaccida. It is little bit loose, so it is flaccid. That is the reason it is called pars flaccida. and the part is thin and it is loose, so it is lax and it appears pink in color. Surfaces of the tympanic membrane presents lateral and medial surface. So here is the medial surface. The other side is the lateral surface. So the lateral surface of the tympanic membrane is concave towards the meatus, and it is directed downwards, forwards and laterally. Whereas the medial surface is convex and bulges into the middle ear. So here is the middle ear cavity. So we can see it is convex towards the middle ear cavity. The point of maximum convexity is called as umbo. So this point is the point of maximum convexity, which is called as umbo. When the tympanic membrane is illuminated under inspection, the cavity of the membrane produces a cone of light radiating from the umbo over the anterior inferior quadrant. So we can appreciate the cone of light here. Which is radiating from umbo, the point of maximum convexity. So it receives the attachment of handle of malleus up to the center of membrane. So the handle of malleus is attached up till the center of membrane here. This is the handle of malleus. Structure of tympanic membrane. It is divided into 3 layers. The outer layer is the cuticular layer, which is towards the external acoustic meatus or external ear. This side will be the cuticular layer, and it is lined by hairless keratinized squamous epithelium. Intermediate layer is the fibrous layer, and this consists of outer radiating and inner circular layers of fibers, radiating layer of fibers. And then the radiating fibers radiate from the handle of the malleus. We can see here the fibers are radiating from the handle of the malleus, are the radiating fibers. And inner mucous layer it is lined by the single layer of ciliated columnar epithelium. So that is about the histology of tympanic membrane. Blood supply, the outer surface is supplied by deep auricular artery, which is a branch of maxillary artery. So here is the tympanic membrane from its medial surface. The outer surface it is supplied by deep auricular branch of maxillary artery. Inner surface is supplied by anterior tympanic artery, which is a branch of first part of maxillary artery. So it is supplied by anterior tympanic artery. So we can see the anterior tympanic and posterior tympanic artery. And we can also appreciate posterior tympanic artery. Posterior tympanic artery is a branch of stylomastoid artery, whereas the anterior tympanic artery is a branch of maxillary artery, that is the first part of maxillary artery. Venous drainage, the veins from the outer surface drain into external jugular vein, and veins from the inner surface drain into transverse sinus and pterygoid venous plexus. So the nerve supply, the anterior half of the lateral surface is innervated by the auriculotemporal nerve, and posterior half of the lateral surface is innervated by auricular branch of vagus nerve, and medial half is innervated by the branch of glossopharyngeal nerve via tympanic plexus. So that is about the nerve supply. And in this image we can see the cauda tympani nerve, which is a branch of facial. So it crosses the tympanic membrane. It is just related to the tympanic membrane on its medial aspect. So cauda tympani nerve is like a landmark separating the pars flaccida from pars tensa. The tympanic membrane develops from tubotympanic recess, which is the first ectodermal cleft and the intervening mesoderm. So tubotympanic recess is lined by the endoderm, ectodermal cleft is lined by the ectoderm and intervening first arch mesoderm. So altogether 3 layers join to form this tympanic membrane. So tubotympanic recess is formed by the union of first pouch, that is the dorsal and ventral wing of first pouch, and part of second pouch, that is dorsal wing of second pharyngeal pouch. Altogether they join to form tubotympanic recess. And then this opposes the first ectodermal cleft with the mesoderm lying in between. So hence the tympanic membrane consists of, from superficial deep, all 3 germ layers, that is ecto, meso and endoderm. These 3 layers correspond to cuticular layer, which is derived from ectoderm, intermediate layer which is forming mesoderm, and mucous layer is derived from the endoderm. Let us understand few clinical correlations of tympanic membrane. An examination of tympanic membrane, that is inspection of tympanic membrane with an otoscope, provides significant information about the condition of middle ear. The color, curvature, presence of lesions and position of malleus are the features of significance. When the tympanic membrane is illuminated for examination, a cone of light is reflected on the antero-inferior quadrant. So if you divide like this is the antero-inferior quadrant, antero-superior, postero-superior, postero-inferior. So in the antero-inferior quadrant, we can appreciate a cone of light which from the umbo it is, and which marks the attachment of the handle of malleus. So hence the membrane is translucent with structures lying deep to it will be visible. So structures lying deep to it are like handle of malleus as a yellow streak extending from the umbo upwards and forwards, and lateral process of malleus as a white prominence on the upper part of the streak of the handle of malleus, and long process of incus as a white streak behind and parallel to the upper part of handle of malleus, and a cone of light at 5 o'clock position in the antero-inferior quadrant. And clinically, the tympanic membrane is divided into 4 quadrants by the means of 2 imaginary lines passing through the umbo. So we can see passing through the center point umbo, we can divide it to 4 quadrants. So one is drawn along the handle of malleus, the other is to the right angles of malleus. So one is drawn along the handle of the malleus, the other is drawn along the right angles of malleus. So perforations of tympanic membrane may occur due to the external injury or infection in the middle ear called as otitis media. Sometimes an incision is given in the tympanic membrane known as laryngotomy to drain the pus from the middle ear. So the incision is usually given off in the postero-inferior quadrant to avoid injury to the chorda tympani nerve. As I was saying earlier, chorda tympani nerve which crosses the inner aspect of the membrane in its upper part. So that is the reason always the incision, the chosen site is postero-inferior quadrant of tympanic membrane. So this completes the normal anatomy and clinical aspects of tympanic membrane. Thank you.